like to introduce Pastor Jeremy and Cassie Husby. Cassie is a 32-year-old wife, mother, daughter, sister, and friend who has cystic fibrosis, or CF. After moving from Medford, Oregon, where her father served as a missionary to Ann Arbor, Michigan as an infant, she attended and graduated from the local Wells Elementary School and area Lutheran High School. In the summer of 2006, she married Jeremy Husby, her high school sweetheart. Outside of a handful of exacerbations, Cassie's parents, family, and friends worked hard to make sure her childhood and adolescence were not defined by her CF. Between 2010 and 2011, her health began to decline quite rapidly. Lung function numbers were running between 18 to 25%. Week-long hospital stays were happening every 5 to 6 weeks to treat infections. Finally, in May of 2013, Cassie was put on the transplant waiting list. After just 2 months, she got the call. 12 hours later, however, Cassie was back in the recovery room, but without new lungs. The surgeon had deemed them unusable. After waiting about 4 more months, on November 17th, Cassie got the call again, and this time the surgery took place the following day. Now, over a year post-transplant, she is charting lung functions numbers at over 100%. And other than a big scar and taking a cocktail of pills 4 to 5 times a day, she's living a pretty normal life. Cassie and Jeremy, who's pastor at Peace Lutheran Church in Hartford, Wisconsin, live in Hartford with their 5-year-old daughter, Layla. Cassie and Jeremy will speak about the many days and weeks spent in the hospital and how during that time a select few nurses set themselves far above the rest with respect to their abilities, communication, and bedside manner. Please join me in welcoming Cassie.
Just waiting for the PowerPoint to be set up. So.
Good morning. Like she said, my name is Cassie Husby, and this is my husband Jeremy, and we're here today to talk to you because I have cystic fibrosis, a genetic disorder which is affecting about 30,000 in the United States and about 70,000 worldwide. I was diagnosed with it shortly after birth. For those of you who don't know, cystic fibrosis, or CF, is a genetic mutation which creates extra thick, sticky mucus in the body. It basically affects 2 main parts of the body, the respiratory system and digestive system. Most CF patients suffer from one more than the other, but I won the genetic lottery and I suffered pretty severely from both since birth, lucky me. But throughout my childhood and adolescence, I was very blessed to have family and friends who didn't let the CF define me. They let me be a normal kid as much as my body would let me. I played sports, I sang in choir, I dated a really handsome guy in high school. Basically anything a normal kid would do. In the summer of 2006, Jeremy and I began married, and then in spring 2009, we had our daughter, Layla. And during my pregnancy, I was actually probably the healthiest CF-wise that I ever was. But quickly after that, it came crashing down. 2010 through 2012, hospital stays were more frequent, 1 to 2 week stays. I would get healthy enough to get out, just lay myself back in 4 to 6 weeks later, which was never fun. But finally in 2013, I was placed on the transplant list because my lung function was between 15 to 20%. And like she said, in November, I finally did get my call and my lungs. And 3 weeks later, I was actually back at home breathing for the first time in a very long time. But throughout my life, and especially the last 5 to 6 years, I have gotten to know and received a lot of care from a lot of nurses. And we're so happy to talk to you today about some nurses and how they stood out above the rest Not necessarily because they were smarter or more skilled, but the way they provided the care was nothing short of a gift from God.
We really recognize that the work that nurses do is one of those things that is truly a gift from God. In the book of Isaiah, chapter 45, the prophet is dealing with a group of people who have been rebellious against God. They have gone and worshipped other gods. They have done all sorts of things to show themselves to be truly not followers of God. And there, as Isaiah is talking to God about the people, he says, truly you are a God who hides himself. And as he's talking about that, certainly he's talking about things that we understand, like our sinful nature, that won't allow us to reach out to God without the Holy Spirit working in us first. And talking about the different things where those Israelites couldn't find Jesus or couldn't find God to follow him on their own. But one of the other really cool things that's built into that is something that Martin Luther picked up on. He said the fact that God hides himself is at times a very, very good thing. Certainly, again, because of our sinful nature, we can't be in the presence of a holy God. But also, the fact that God hides himself, Martin Luther said God often wears masks to care for his people. Some of those masks are things like being the butcher. That's okay. Being the butcher, being the baker, being the parent, being the doctors and nurses. And actually, once we get this set up, I've got a quote for you to read to you. It's from a book that was written on Luther talking about that very idea of vocation and how God works through the people working in everyday lives, not just church work, but in your everyday lives, doing the regular things that people do, and how God is actually working through those people. And so as soon as that's set up, I'll read that quote for you. Until then, right now, you can ask us any questions you want about the color of my tie, or how her dress fits her very well, or...
The screen is right in front of you.
Okay.
Cassie, any other members of your family have CF?
When we did like I was the first one diagnosed that we really knew of. So when we tried doing the whole genetic testing to see how far back we could go, we're guessing possibly 2 great aunts might have had it. Both died very young in infancy. One had very bad digestive problems. So they're kind of saying probably them, but no one else that we at the time really knew of. And no one, my mom was like, I don't even know what CF is. Like, you don't think of that. So yeah, so after that, of course, then they started trying to trace it back and stuff. I just, again, won that nice lottery.
So is there a way to switch the input? There you go. All right, so this quote that I was talking about from a book, Luther on Vocation by Gustav Friedrich. What he says there is, in his vocation, man does works which affect the well-being of others, for so God has made all offices. Through this work in man's offices, God's creative work goes forward, and that creative work is love, a profusion of good gifts. With persons as his hands, or co-workers, God gives his gifts through the earthly vocations, towards man's life on earth, through food through farmers, fishermen and hunters, external peace through princes, judges, and orderly powers, knowledge and education through teachers and parents, etc., etc. WELSNA is part of that, etc., etc. Through the preacher's vocation, God gives the forgiveness of sins. Thus, love comes from God, flowing down to human beings on earth through all vocations, both spiritual and earthly governments. And so, as I said, we entitled this God's Hands because you guys are there being God's hands, distributing the gifts of God into this secular world. And so as we recognize the work that you do, we recognize that you guys are indeed gifts from God. Because there's no other way that God has shown that He will care for His people in physical ways like this, especially with a person with cystic fibrosis, a person who needs a double lung transplant. God has shown that He can show that care through doctors and nurses, and doing so with great love.
We both love nurses. Like, we love you guys. Like, we love you guys. My body loves you guys, and in particular, my lungs love you guys. Here's a picture that you can actually see how much my lungs love you guys. This picture here is a picture of my old, mucousy, scarred up, nasty, bad CF lungs. This is my little port, which I just think is cool in the X-ray. And this picture over here is a picture of Francesca and Shannon. My new blinged out, perfect, healthy set of lungs. Now you might be wondering why they're Francesca and Shannon. Those are actually two names of nurses that took very, very, very good care of me right after transplant, and not only good care of me, but of my family as well. What sets Fran and Shannon apart and are worthy of lungs being named after them is they just followed a basic rule that is patients are people, not just another case study.
I really like this picture for a lot of different reasons. One of the reasons why I like this picture is because this is 3 days after her transplant. 3 days after her transplant, my wife was up and walking. She was moving around on her own. Certainly she was using that wheelchair as support, but she was up and walking 3 days after transplant. Just blows my mind. The other thing that I really like about this picture is you can see the guy going like this. No, that's not me. That's my father-in-law. That's her dad, Pastor Zell. Her mom is there as well, and then her aunt is there. And the reason I like to show this picture is because what you see about all three of them is that they're all wearing masks. They're all wearing gowns. They're all wearing gloves. None of them are nurses. But the reason why they're wearing all of those different things is because they care about Cassie. And as you probably well know, after a transplant like that, her immune system was so suppressed and depressed and that she can't fight off any germs. She can't fight off any viruses. She can't fight off any sicknesses. And so anything that we, as we're being around her and giving her emotional support, anything that we would bring in would hurt her. So we covered ourselves up. Well, we did as much as we could to show her our love and being there for emotional support, but we knew that we would not be able to provide the medical support that she needed, and so we entrusted that to nurses. But we expected them to show her the same exact love that we did. Because we care about her so much, because we wanted to entrust her to these people, we wanted them to share the same manner of love that we did.
I had gone into the hospital, and as you guys know, most of you probably do, when you get admitted, there's nurses in and out. It's crazy ones checking your blood pressure, temperature, weight, questions, all that kind of stuff. They started really before they could put up any signs to say I needed the mask and the gown. And a nice nurse came to check my blood pressure, and she was really kind, and we were just chit-chatting, and I knew she didn't have a mask on, but I knew she was also just kind of in a hurry. And a masked nurse walks in, looks at the unmasked nurse, and says, "You need a mask." A very nice unmasked nurse says, "Oh, I'm so sorry." You know, not a big problem. Well, the masked nurse just said, "Oh, don't worry, it's not going to kill you." So, me taking it back, and said, "Yeah, but it could kill me. You know, I'm your patient. Not only could it kill me, but the germs I have could go to another room and kill that person." So, that was kind of a little surprising.
That shows then again this whole idea of treating me like a real person. If she comes in and says, "Oh, don't worry, it's not going to kill you," talking to another nurse, well, again, the main concern is the patient in this situation. If she's not caring about Cassie's health and Cassie's contracting of different germs, then that doesn't show her to be a person who's caring very much.
We have the bullet point of IVs. this is kind of a big one that I personally have, but to put it frankly, don't practice IVs on me. I'm a person, I get bruises, I feel the pain of pokes in and out and needles moving around. Yeah, that's a pretty gross bruise. But I will actually respect you. Still, I will still respect you if IVs aren't your skill. I will actually respect you more if you know IVs aren't your skill and you just go, I don't see a good vein on you, I'm gonna go get someone else. I will respect you even more.
That's
for
from
that.
an IV or blood gas?
Yeah, that's what this one was.
Okay.
The one I
I'd
have.
really question if they were putting an IV there.
Yeah. The one of my IV, the picture was really blurry, so we just used this nice bruise here. But they actually haven't tried putting IVs in weird places on me before. And this also goes not just for IVs, but explaining a procedure or medication. If you're not quite sure, it really is okay to go get someone who does know. And again, I have no problem with you looking at me and saying, you know what, I'm not quite sure, let me go ask.
Along with that, treating you like a real person, I want to make sure that I give you the best care that I can. I want to make sure that you're as healthy as you can possibly be while you're under my care. That whole idea of making sure you have the right person doing the right things. The other thing is just really simple. Just use regular manners. Things like looking a person in the eyes when you're speaking to them is a huge trust builder, a huge confidence builder. Because that tells me, as the spouse, that you care enough about my wife that you're going to talk to me. It tells her, as you're talking to her and looking her in the eyes, that you care enough about her, that this is important, and you want to make sure that she gets in the information and that she understands. That is such a trust builder and such a confidence builder, and I'm a whole lot more willing to listen to the things that you have to say if you're going to look me in the eyes. On the flip side, though, realize also that I'm going to be looking you in the eyes. For about 95% of the care that we have received through nurses, we have been just overexcited and just have been so well treated throughout all of the time that we've spent with nurses, for about 95% of the time. There have been, though, those couple of times where we've had some bad experiences, and one of them just had to do with that. I was looking a nurse in the eye when I was speaking with her. After Cassie's transplant, one of the really funny things that happened was she obviously was in a lot of pain. And it was because she had this big scar that went clamshell under her chest where they lifted her up. But her body didn't feel the pain right here. Her body was playing tricks on her, and her body felt the pain in her back. And so one of the things that really helped her was putting heating pads on her back. Well, one time the nurse came in and I was asking her, where is it okay to put the heating pads? Where is it not okay to put the heating pads? And for whatever reason, she rolled her eyes at me after asking that question. From that moment, I had no trust for her. I had no confidence in her ability to care for my wife. And in fact, as soon as her shift was over and the next nurse came on, I said, please don't ever put that nurse on my wife's care again. I don't trust her. I don't want to listen to her. She was extremely unprofessional, and I'm not going to deal with that when my wife's life hangs in the balance. Just those general rules of manners, not rolling your eyes, seems like an easy thing, but sometimes you have to think about that. The other one that's really simple that goes along with that same idea of manners is not just waiting for your turn to talk, but actually listening. I was overwhelmed with how many of the nurses that we've had who are able to listen so well. As I'm searching to figure out the best way to ask a question that I don't understand the answer to, if I'm looking to try to explain the feelings that she's having when she can't explain it either, and these nurses are sitting there and they're listening, and they're trying to offer their best explanation, they're trying to offer their best answers because of what they heard me say. I was just blown away at how well they listen, and Cassie says, well, you realize that's because they're women, and so women can actually listen. But
This is another stellar nurse that we had during the transplant. Her name is Shanna, And this was probably about 10 hours before transplant. And I had just gotten done. I had to wash my body with a certain kind of soap just to make sure I was extra, 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 extra clean. And to tell you the truth, pre-transplant, I didn't shower every day. I was lucky if I could walk around the house every day. And when I got the call, I was probably, I won't even tell you the last time I probably showered. I was very, very dirty. So I decided I was going to wash my hair because I knew it was going to be weeks before I was going to wash my hair again. Well, I washed my hair and I didn't really know what to do with it. I mean, I didn't want it to like be in my face, but I didn't want to be up in a ponytail because after 2 weeks I knew it was going to hurt. I mean, you girls know that feeling, but I knew I wanted to braid, and I knew Jeremy couldn't braid whatsoever. Well, word got around that I wanted this braid, so Shanna just walked in. Oh, I heard you wanted to braid. Just getting all gunned up. Okay, let's just do it. And she's just talking to us. She knows we're nervous at this point. I mean, like I said, we're 10 hours transplant. We don't really know what's going on. She's just talking to us like we're normal people, not excited because she knows we're not too excited. Very calm, very cool, just braiding my hair, whatever. And she even just made the comment of, wow, this is the best braid I've ever done. And I kind of joked, I was like, what a waste, you know, like I'm just gonna be in bed for the next 2 weeks. And she goes, this is the perfect opportunity to have the best braid. And like, that little comment to me was just huge. I mean, she didn't have to say that. It wasn't, like, really, it is a waste. I'm just gonna sit in bed. But she wanted me to feel so good about myself going in to transplant. We're both well aware, and we appreciate the fact that you guys work probably twice as much, twice as hard, and much less paid than most doctors. And again, that's another reason why we both really love you guys. And we know that you guys also put in extremely long hours. One thing to keep in mind though, when you are putting in your long hours and you're almost done with your shift and you just had a really bad day because this patient did this, oh, you know, whatever, we get it. I try not to be that patient. Anyway, we know you get extremely worn out. We're in the same hospital you are at the time. You can look at the clock and basically kind of get the idea of when you're going home. Your patients don't always have that same luxury. We're scared. We don't know what's going on. You guys get to go home and live your normal lives. You get to go see your family, your friends, you get to sleep in your bed. Again, I might not know that. So for you to say, oh, I'm gonna be so much better in 3 hours, I get to go home. And I can't tell you, there's been quite a number of times people say that. I know, you guys are excited, I would be too. So I was like, oh yeah, I'll be excited in a few days, hopefully. So just something to...
That same kind of idea, if you take the timeline of Cassie's transplant, so she got the transplant on the 18th of November, well then she was there for 3 weeks, and so what holiday is there? Thanksgiving. So we were in the hospital for Thanksgiving, and it was kind of nice because my parents were actually able to come up, and so they were there for that as well, but nobody wants to be in the hospital for Thanksgiving. Not patients. I know nurses and doctors don't want to be in the hospital for Thanksgiving either, unless you have a really terrible family. But we know that you guys don't want to be in the hospital for Thanksgiving either. But I can tell you, not one of the nurses or doctors that we saw that whole day did any bit of complaining about being there on Thanksgiving. In fact, they did quite the opposite. We sat there and we ate cafeteria Thanksgiving food, and they were sitting outside our room eating cafeteria Thanksgiving food and talking about which parts were good and which parts were bad, sharing the experience with us so that we didn't feel like we were missing out more than other people. We felt comfortable with them because they were missing out just as much as we were. The same goes true for, we're not originally from Wisconsin, so I know you guys are big on the Packers. But when there's Packer games and you're in the hospital, I understand that that's a hard thing for you guys. But you don't have to show it. And again, this is something that we never really had to deal with, but we understand that that's something difficult, something as silly as a Packer game, or we were over in University Hospital in Madison, and so Badger games go on all the time. We understand that those are big, cool things to do, but the fact that we're missing out on it too, you talking with us and treating us normal, even though there's big events going on in the real world, helps us feel a whole lot more comfortable about the situation that we're in. And that whole idea of helping us feel comfortable, we're not asking you to go a mile in all of the different things that you do, but just those little things that you do to help us out, just that extra 10 feet makes us feel a whole lot more comfortable when we're sitting in that prison cell for 3 weeks, not knowing exactly when we're going to get out.
Yeah, like Jim said, like as a patient too, for me, those little things might be the 10 feet for you, but for me it really is that mile. I've had quite a few nurses do some outstanding things that they probably don't even really realize how big it was, but I still remember it. Brooke, my nurse practitioner, talked me into getting a G-tube. I didn't want it, I understood I needed it. Okay, fine, I'll get it. She came in, just happened to be in the room when I was about to get a procedure done. Instead of stepping out, she could see the fear in my eyes of not wanting to do this. So without her blinking an eye or without me asking, she just grabbed my hand. Like, she's right there with me, like, you're gonna be fine. My nurse, Erin, often would come in and just talk about non-health related items. She'd sit on my bed and gossip with me, girl gossip. Like, it's just like, okay, you're normal, I'm normal, we're having fun. Fran, one of my nurses with my mom, she talked about her family's pizzeria in Michigan. And now when my parents come on through, they always stop at that pizzeria and then come and see us and say, oh, tell Fran that we ate at the pizzeria again. It's all those little things that really do matter. The other thing that, I'm not sure if it's little for you guys or not, but shift change when they're seamless is so nice too. Like, it's just unbelievable when a nurse already comes in and says, okay, well, I know you're doing this, this, that, and the other, versus me having to then again explain things like, well, I know I was supposed to get this done. Oh, no, I already had that. So that's really huge for me too.
What were my teachable moments?
This is kind of a weird one, but trust me, it's true. Just because I'm wrong as a patient doesn't mean my opinion isn't valid. I'll have a couple examples here, and they're kind of embarrassing, but that's okay, because you guys have seen worse, I'm sure. Shortly after transplant, the drugs were messing with me big time. Jeremy to this day still has to tell me what day I did things on. I missed an entire day. I had a catheter in, obviously. I wasn't going to be able to walk right away. I knew I had a catheter in. I was told over and over again I had a catheter in. There was a night I had to sit on a toilet to go to the bathroom. And my mom was there that, you know, Cassie, you have a catheter. You're already going, no, I'm not on a toilet. I have to go. That nurse got wrong every half hour for probably about 5 hours. And she just came in, put me on the toilet, would leave, then she would call back. Was I annoying? Yes. Was I wrong? Yes. But she never made me feel that way. And there's definitely a way of letting your patient know they're not always right, but they're not wrong. Another one too was I couldn't get comfortable. I was in a lot of pain, like Gina said, my back was just in a lot of pain. I would fall asleep for 5 minutes, wake up and say, I need to sit in the chair. I would go to sleep for 5 minutes, say, I need to be in bed now. And I go back and forth and back and forth and back and forth. And again, annoying, absolutely. Was I wrong? I didn't think so. I didn't think so.
She was, though.
Yeah, I was. But at the time, I didn't think so. So, oh, sorry. There's also opportunities there too that you guys can learn, because like I know how CF affects me. I know how transplant affects me, and even though they might not be from the textbook. Perfect example is a couple weeks ago, I had something wrong. I couldn't figure it out. Not to be gross, but I was having like blood clots in my throat. And they weren't coming from my lungs. We didn't know where they were really coming from. Went and saw a primary doctor, and he said, we don't know what's wrong, but it's not this, that, and the other, so we're not going to give you any antibiotics. I was like, kind of weird, but okay. Went back the next day, saw another doctor. He said the same thing, and I kept going, I know that's not right. So I just called my doctor in Madison and just kind of said, you know, this is what's going on. He's like, nope, we're pumping you full of antibiotics. Was that doctor, my primary doctor, right? I trust him with Jeremy, I would trust him with Layla. But I knew for me, that wasn't the right thing. He was following the textbook. Don't pump someone full of antibiotics because your body doesn't need it. But because of my immune system, I did need them right away. Pump me full and then figure out what's wrong. So there are definitely ways. Oh. Sorry. The other thing with IVs, again, like I said, my IV thing is really, I hate IVs, is probably what it is, but I know good veins in my body now. All the veins that look beautiful are awful, like awful, but all the veins that are really sneaky, I'm like, I know if you hit right here, you'll get it right away. And a lot of times they you know, sure, that you can't even see that vein. This vein's beautiful. And I'm always like, try it. They miss 5 times, and they're like, oh, we better go get someone else. Vein specialist comes in and goes, oh, the vein you pointed to, that's the perfect one. So.
Yeah, that whole idea of taking time from changing theoretical into practical, that's something that I had to learn firsthand in my work as pastor. I'm sure everybody has to learn it firsthand when they start their jobs. Things that you learn in your textbook, when you actually get into the real life situation, it's a little bit different. You can't just always apply the rules to each and every person. Every situation is really different. I have 3 brothers, 2 of them married Roman Catholic girls. Really, really good Roman Catholic girls. They go to Mass every week, and so my brothers go with them. Well, I could say to my brothers, this is what your wife believes, because I know what the Roman Catholic Church teaches. But then when I go and I talk with my sisters-in-law, they don't believe the exact same thing that the Roman Catholic Church teaches on the books. And it's kind of the same thing with healthcare. Cystic fibrosis has a whole mess of things written down in the textbook about how to treat it. Post-transplant has a whole mess of things to write about in the textbook about how to treat it. But Cassie is different. We just had another man with a lung transplant in our congregation. Their outcomes are completely different because their disease was different, because their recovery was different, because their health going into the transplant was different, because they have different bodies, all these different things that take the theoretical and you have to actually apply it into the practical. Part of that is you guys learning from the patient herself. Like she said, she's got 32 years of dealing with this particular case. And so she knows her body a little bit better. That was one of the things that really sold us on driving all the way over to Madison for her care, is that her doctor understood that. He goes and he talks about cystic fibrosis in Brazil. He goes and he talks about cystic fibrosis in China. But when it comes to caring for Cassie, he says, Cassie, what do you think? Because she's been dealing with it longer than he has. Part of that, though, is understanding who your audience is, because while all of that is true for Cassie, I don't have cystic fibrosis. I don't know what each of those things feel like. I don't know why your back hurts when you have an incision on the front. All of that stuff doesn't make any sense to me. And so I need you to explain it to me. And so I'm going to ask a ton of questions. I'm going to ask you why that pill does that, or what that pill does. I'm going to ask you what those numbers are on that machine, and I want to know which numbers I should be looking for, which numbers are good, which numbers are bad. And I need you to be able to tell me that. I'm not going to ask those questions because I don't think you're doing your job, because I don't think you're smart enough or whatever. I'm asking you those questions because I want to know, and because in a couple of weeks I'm going to be doing all this on my own. And so I need that information. And so again, knowing your audience really helps you understand what things you have to explain in which way, and how you can then learn how this practically plays out for each person. One of the most memorable events that happened for her transplant was really part of this, knowing your audience and then being able to speak confidently. She had her transplant on a Monday morning. Monday afternoon, I got to speak with the surgeon who did the transplant, and talking with him, and he said everything went really, really well, and made sure that he did his job of saying, but anything can go wrong at any time, but saying everything looks really, really good. There's only one thing that we're really, really worried about. and that is she had 4 chest tubes at that time, and they were draining kind of a thick, sticky blood. And he said, we would really like that to be a whole lot thinner, a lot more watery, and almost a pink color as it's coming out. Right now it's not doing that, but we're going to watch it for a while. But he said everything is going really well. So I went in and I kissed her on the forehead, and then me and my father-in-law went out for dinner. Came back from dinner, gave the nurses my phone number and said I'm going to go over to that room right there and fall asleep on a couch because I haven't slept in 36 hours. About 4 hours into my sleep, there was a knock on the door. Francesca. She said, we tried calling you while we were in the hospital. The phone didn't work, but they knew where I was. She says, we're going to have to take Cassie back in. I was, number one, no sleep, wondering the worst. I'm there all alone. My in-laws had gone back to their friend's house 40 minutes away. And I said, why? She said, well, we're going to do what's called a wash. And she explained that by opening her back up and washing everything out, it was going to help with all of the clots and things like that, so that the blood would then drain a whole lot better. What she also ended up telling me too was that they were going to insert another chest tube. But at that point, just waking up on no sleep, I had no idea what she was talking about. And so I said, you're going to have to explain that to me again. The whole time we're walking in the hallway back towards her room. And so she explains it again. And she does a better job of explaining it, but still, I'm not really catching on. The whole time she's looking me in the eyes, she's speaking very confidently, very straightforward, and she says it again for the 3rd time. And I said, okay, I think I understand it. Now what I need you to tell me is, should I be calling my in-laws to come back here? And she said, well, in all honesty, that's really up to you. And I said, no, I need you to tell me whether this is something that I should call my in-laws for. And she said, well, really, honestly, that's up to you. And I said, what I really need you to tell me is my wife going to die? Any person in the world, if you ask them that question, they're going to have to think about for a minute and say, well, how can I craft this best so that he understands it? Not without a second thought, she answered no. Looked me straight in the eye. That's not what this is about. We're doing this, she's doing fine, this is just going to help. Very calmly, but very confidently, letting me know that she was going to care for my wife. That I didn't have to worry. All of my worries were set at ease with her looking me in the eyes and saying no. Because she was confident. Because she portrayed to me that she knew what she was talking about. And at that point then, I could trust her. I was happy to leave my wife in her hands because she knew what she was talking about. Or at least she appeared as though she knew what she was talking about. But that's what we need. Because nurses are really our pipeline to the information that we need and the care that we receive. And if I can get that information from you, if I can see that you're caring for my wife, and I can see that you're doing it in a confident way, that helps me so much. To show you how much that really does help, this is Cassie right after transplant. That picture over there, less than 20 days. We were at a hotel. She was eating waffles for breakfast. We walked down to breakfast. We walked back to our hotel room because of the care that nurses gave for her. Yes, and not just because I'm a pastor. Certainly I realized that God was working there. But again, that's this whole idea of you guys being God's hands. You guys are the ones who are carrying out the work that God has you doing, not with the Word of God, not by baptizing people, not by giving them Holy Communion, but by providing for their physical needs, which God tells us that He cares about. And so you guys are those tools that He uses to make sure that things like this can happen. And so we are so very thankful for the work that you do, and we want you to feel confident in knowing that the work that you guys do is good work. It's good work because you're carrying out God's purpose for your life, but also carrying out God's purpose for my life as my wife is continuing to heal. All of those different things working together. When you guys do this and you know what you're doing and you show that to me and to the patient, that helps so much so that things like this can
one more thing I'm just going to add to that is, we talked about this actually on the way to the car, because we were like, it kind of almost sounds like you have to be like this happy person. We've had some nurses that are just, will just come in without a smile and just do their job, but because they have that confidence, we're like, we love you. We've had nurses that are just rambunctious and come in and joke after joke after joke after joke, all while doing their job very confidently. We loved her. It doesn't matter necessarily your personality, it's all in the way you carry yourself.
Right. Yeah, we recognize that everybody has a different personality. And that's fine because, again, that's the way that God made you. But still be confident in the work that you're doing. That's why you're going to all the schooling that you do. That's why you go to a conference to figure out these things, is so that you can continue to do your work at an extremely high level. And that's what we need you to do. So that is the presentation itself. We did want to leave time for some questions. We're certainly happy to answer anything that you guys might think of, or try to answer anything that you guys might want to ask. Yes, please.
I have a question. You know, you said that you like when nurses get personable and stuff like that. I always wondered how much about a nurse's life do you want to know? You know, I mean, here you are sick, and I know they're trying to make you feel better, but do you want to know my life story?
No.
You know?
Right, maybe not where you were born. So maybe not necessarily this. A lot of it is just natural flow of conversation. You know, just like, I guess the way I'll say this, if you ran into me on at this conference, natural conversation, if it happens, I learned that, I don't know her name. I don't know this nurse's name. I know that her sister-in-law lives in Livonia, Michigan, which is exactly where his parents live. Like, all those little things just happen. So I guess it's more, if I'm, oh, you have a daughter. Yeah, oh, I have 2 kids. And, you know, just like stuff like that. It's all those little things. I don't even know how the pizzeria came up. I really don't. But,
I think some of that is social cues. You know,
Yeah.
if you're coming in and you're talking to someone and they're sitting there stone-faced and they're not saying anything, well, then maybe it's not time to have that type of a conversation. But if you're talking to them and they continue with the conversation, then that's the opportunity to share whatever comes as you're talking. Yeah, and I think what she said is an important thing too. If you would have this conversation outside of a hospital room, would you feel comfortable having that conversation with someone that you met at the grocery store? Would you, would you tell your whole life story to the cashier at the grocery store? Well, or would you just say, oh, I got this frozen pizza because my husband's at work late tonight? You know, things like that. Does that help?
I think that somewhere in my life I heard a quote from somebody that stuck with me, and I think it addresses what she's saying, and I think it's addressing everything that you put up here. And that quote is, nobody knows, or nobody cares how much you know until they know how much you care. And in dealing with professionals or volunteers or anybody else, I think it's just always important to understand that mindset that you talked about trust. Trust is gained by the person knowing that you actually care about them.
Right.
You know, then you can go into who you are, what you are, whatever. But earning that trust up front by saying, you know, I care for you, and I care about you and what's going on in your life. And again, that's any profession.
yeah, like, kind of like going with that, the nurse Erin I was telling you about, who just came and sat in my room and gossiped with me. At the time, we couldn't obviously be Facebook friends. I know I'm talking about social media here, but that was when I was more of a CF patient, now than a transplant patient. Her and I are Facebook friends. We talk over Facebook a lot. Whenever I'm in the hospital, I always text her, hey, where are you? Can I come see you? Like, now we have even more of a relationship than just patient-nurse. It's more like, how's Jason, your son? Like, you know, it just kind of, again, goes with that natural, like, you learn more too. The more I go in, the more I learn about, like, Francesca, or so that also. And I also know that some patients are like a one-time, I'm in the hospital because I have a weird, you know, something's wrong, and that I'm a lifer, but.
Yeah, please.
Oh, did any of your nurses ever offer to pray with you? And how did you feel about that?
I think the closest that we came was for her dry run. It was, the way that it worked out was just so weird. Her parents were able to fly in from Michigan. Her godparents came over from Lake Mills. Her sister flew in. She's a flight attendant, and so she was somewhere else, but she was able to fly in. And so we had a room filled with like 10 people. And right before they were going to take her down, the nurse came in and said, I have a chaplain with me if you would like to pray. And it was actually a little funny because I said, well, I'm a pastor, I'm her pastor, her uncle, her godfather is a pastor, and her dad's a pastor, and so I think we're all set right now. But I think that if they would have, I have always been of the mind, if you as a nurse want to say a prayer, I'm fine with it. But again, I think that's kind of a case-by-case basis, one of those things that you might feel. But I think asking the question, would you like me to pray with you? I think that's for us, I think that would be a very regular question, a very open, received question.
It was even like, he said for the dry run, we had all these people. The real deal just happened at such a weird time that no one else could get there, so it was him and I. And we were there, I mean, we were very okay with it, but it was the time, like, maybe if a nurse did say, like, I mean, if he wasn't a pastor, again, like, that's different too, because he's a pastor, and he knows me a little bit, so he knows what to do, but I think that would have been different too.
More of a comment than a question. It's really for the many students that we have here. You both talked about confidence and the confidence of the nurse, and I don't want you to think that when you graduate you're going to know everything from nursing school, because trust me, even us seasoned nurses have a lot to know. But it's a good point to show that when you're going to go do something in life at the bedside, if you are not 100% confident of what you're doing, the time to look up in the book what you're going to do or the history is before you step into the room, and not when the question is asked. Because very frequently nowadays, our patients, they have their phones. They will look up the things, and they will, it may not make sense, but they'll have a little bit of information, and then they'll ask you to fill in the blanks, and if you don't know those blanks, think about how you're going to come across to them as their nurse, the nurse that doesn't know how to take care of them.
And that's actually a very good point. Post-transplant, I am in the same wing. I have the same, I know all the nurses know, I have the same nurses, they all know CF, they all know transplant. The CF wing, I would get, it was more night nurses, I guess. I would get the ones that would kind of talk about CF, would kind of ask me more questions, which I understand not everyone's going to know CF, but that's a good way of, okay, this patient has CF, let me brush up on it a little bit. Let me at least know what it affects. Like, that's a very good comment.
Yeah, because we understand that swing shifts happen.
Yeah.
We get that totally, and so this may not be your specialty, but if you could do that little bit of a brush up just to know a couple of things that, and I know I'm saying it's just easy, just brush up a little bit. I understand that it's a difficult thing, but that's what helps us take confidence in you, is that you work so hard during your schooling and then continuing education to be the best nurses that you can be. We're taking that trust in you because I'm literally putting her life in your hands.
I would be interested to know how the surgery affected your daughter and what kind of interaction from the nurses with your daughter.
We were very fortunate enough that we had talked a lot, because that was one of the main things about transplant is, before I actually said yes to the transplant, I was very worried about Layla, our daughter. And I said, I just don't want her, I don't want her to see me in the hospital. I didn't want her to see me like this. I mean, she's already, with my CF, she's already very, like, not scared of it, but just scared of the fact that she might not have a mom. We were very fortunate enough that when we got the call, we already had 10 families around us to call no matter what time to say, could you just take Layla tonight? Someone took her right away. We had pre-talked to her quite a few times about, one day Mommy's going to get a call and you're going to get to go to so-and-so's house, and we just always made it very exciting for her. One day Mom's going to run with you again. One day Mom's going to push you on the swings, we're going to the zoo. It was always very exciting. And so actually when we got the call, Jeremy like grabbed Layla. I was like, oh, Mom's getting the call. And Layla started jumping up and down. I get to run with Mom. I get to run with Mom. I get to run with Mom. My parents, after going to the hospital, that picture you saw was their goodbye picture. They took Layla back to Michigan for 5 weeks. According
It
to
was
my
until Christmas Day.
yeah, Christmas Day we surprised her. We were her Christmas gift. We would hear stories. Of course, my parents were really good. His parents, his brothers, so they were very good about telling us stories because, of course, we really, really missed her. They stopped at the outlet mall on the way home from the hospital after Layla, and Layla, being 4 at the time, is picking out shoes she wants to buy and hands it to the lady and says, "My mom's getting new lungs." You know, and the lady kind of like steps back and looks at my parents, and they're like, "Yeah." She told Santa Claus, "My mom's getting new lungs." You know, like she at school that day, she even did a fist pump. "Yes, my mom's getting new lungs." Like she was very, very much excited about the fact that I was going to run. I still remember the first time I ran with her, and if I cry, I'm sorry. But I was like just walking her home from school, and then she said, "Mom, can we race?" And I was like, "Oh, yeah, why not?" And so I started running, and of course she won because I let her. But yeah, I let her. And the whole time she said, "Mom, you're doing it. You're running. You're doing it." And the whole time I'm just like bawling like a baby about it. She definitely now has issues of dying. Like I always call her a dying abandonment issue. Out of nowhere, all of a sudden she'll be crying in her room. And you're like, "Oh, God, what? What's wrong?" "I don't want you to die. I just don't want you to die. If you die, I'll be all alone." I mean, just
But it's been, that's obviously, you know, one of the benefits of being a Christian is that and having her go to our Lutheran school is that she hears about Jesus every day, not just from her parents, but from her teachers that love her as well. And so we get to talk about heaven and we get to talk about all those good things. But in reality, though she does have those breakdowns, for the most part, God gave us such a gift with our daughter for a number of reasons, but one of the reasons is when she would have a PICC line in or something like that. Mommy can't use this arm. Layla knows Mommy can't use that arm. Mommy's not feeling well today. Mommy has to lay on the couch all day today because she was so worn out and breathless and all those different things. And Layla just, okay, then just a day that I'm going to be with Daddy. She understood those things, so it was a lot easier to deal with it in that way. But as we continue to talk about the new lungs and all of those different things, she is so good washing her hands all the time to understand Mommy can't get germs. She really wants a puppy, but the doctor said we can't get one, and so she understands, okay, can't get one because Mom can't have one. All of those different things have been really good for us and really surprising. The fact that a 3, 4, 5-year-old can deal with issues like that has been amazing for us.
And like Jeremy said, it was just like one of those, like, you can look at it, like I always do, and I believe Jeremy does too, it's like, she again is like one of those little miracles that God gave us. Like he knew that we needed that kind of child in order to get through it. And like Jeremy said too, like she's just very, whatever you guys need right now, well, oh, I have to go stay with Grandpa and Grandma this week? Okay. Like she still, to this day, will ask me, she called the transplant stay, the forever stay. Can I be on a forever stay? Like she's just very, like whatever Mom needs, she's very, okay, we'll just do that today. Does that answer your question? Okay.
Well, again, thank you so much for listening to us today. We recognize that we are just one case, and you have to treat us differently than you treat everybody else. But I gotta believe that a lot of the things that we have felt as we have received care from nurses translates to a lot of people. Understanding the differences in who you're talking to and treating them like a person, using your regular manners, and all of those different things, being confident in what you're doing. That really helps us, and you guys are really doing great work. So thank you for the work that you're doing. Continue it, keep it up. We're very thankful.